Now we'd like to welcome Don Obermiller with the Wellness Coordinator to discuss our organization health report.
Welcome. Thank you so much for allowing me to come and speak today. I wanted to just give you a little bit of a highlight of how we're doing here with your wellness program. You may want to slide up a little bit if you can, because we're going to be showing a lot of graphs throughout the program to be able to give you an idea of how our data looks for our Simply Well program. Today I wanted to just kind of highlight some things that we do with the wellness program, and then also talk about our 2010 risk data, and as well as our comparison data, and then tell you about a new upcoming opportunity that you can take part in. As you all know, the Creighton Wellness Program makes up kind of many different programs that we offer throughout the year. One of those programs is called Simply Well. It's our online tool that we use to measure progress with our program. As you know, you can't measure what you don't, take a look at. And so what I wanted to do is highlight for you where we're at with our program and what types of data we're looking at when we are measuring all of that information from your screening in the fall. You can see over the course of the years, we've made a really good jump in the number of people that have been participating in our Simply Well program. So when we started out, we were just an online tool, and then we moved up each year. And this past year, we had over 1,500. Actually, we're approaching closer to 1,600 now with some new employees that have come on since we did the initial screening that have been participating in the Simply Well program. As you know, it's HIPAA compliant, private, and confidential. So when we report the information, it's what you're seeing here today. So that's all that the management is seeing. They're not seeing individual data. And then just to kind of give you a quick highlight of how we're doing in terms of the breakdown of different plan groups. So of the 1,505 that participated at the outset, we had a fairly even breakdown between CCAP groups and then those of you that are in PPO1 or PPO2, and even individuals this year that are in the waived group are able to participate in the health screening and the online questionnaire. So it's a great opportunity to foster a culture of wellness here that we support you in trying to make healthy changes. And then let's talk about the risk data that we get from that information. So when we do that health screening with the questionnaire, this is the information that we are able to look at and be able to decide with our Wellness Council, how do we determine what types of programs to offer? And based on this year's data, you can see the Creighton information is the top row, and then the Simply Well book of business. That means Simply Well has many companies that they work with thousands of employees, and so we compare how we do to their book of business. We also compare it to national norms. So you can see anything that's in red means that Creighton is worse than one of those data sets. So we're either worse than a Simply Well book of business, all those thousands of other employees that they measure, or national norms. So as we look at blood pressure, we looked at the pre-kind of hypertensive level, and that's at 120/80 up to 130/89. So if someone had a health screening value that fell in that range, they would be a part of this percentage for Creighton. You can see we're higher than where we want to be there. Blood pressure that was higher risk or measured at over 140/90, we're doing okay yet. Then when you look at the total cholesterol, LDL cholesterol, HDL, you can see all of those values, we are higher than at least one of those data comparison points. And then finally for fasting glucose, this number actually increased quite a bit from last year. Last year we were, I think, around 10%. This year we have, out of those 1,500 of you that participated in the screening, that are seeing blood glucose values raise. Those are based on all of that objective data that's taken from that health screening. So that's not self-report data where you say, oh, my cholesterol is pretty good, or my blood pressure is usually in the range, or I've never had any problems with diabetes. This is talking about real data from the actual screening values. Then to give you an idea of the BMI, or body mass index. That's when we're looking at how we are doing with our body weight in relation to our height. And as you know, sometimes it can be frustrating to get a BMI that is higher than what we would like to see. But typically, a BMI of 25 to 29.9 is considered overweight, and then that 30 and over is considered obese. And based on our screening information this year, we have 66.4% of our male population that are either overweight or obese at Creighton. Higher than what we want to see. When we look at women, we have 58.7% of the females. And the difference is this year what we saw is some of the females went up in the obese category but went down in overweight. So that's not the direction we want to go. Then when we kind of take a quick peek at our preventable risks, when we're talking in the health promotion field, we want to try to help individuals stay at as low a risk as possible, meaning having as few of risks as possible. Because not only will it save you in terms of dollars and quality of life, but it's also going to save the university as an organization. And you can see, based on the measurements that we took, Creighton is in the green at our 5-year ideal, meaning if we really started putting some really, crazy good efforts in to try to make some changes, we could impact our ability to have lower risks at Creighton. So you can see none to 1 is where we want to try to help get people to be at. So meaning when I say risks, I mean blood pressure, body weight, glucose, cholesterol levels. All of those risks play into these numbers. And so as someone, it adds risks, it gets much more difficult to bring you back to a healthier point. So it's really our goal to try to provide those supportive ways that you can get yourself back on track, if need be. When we look at Creighton's top risks as a whole, you can see that based on the 1,505 that were measured back, at the later part of the fall last year, 61% had a risk for their body weight. We had 59% that have a need to work on fitness. Our coronary risk and cholesterol risk has jumped up. That last year it was lower. This year we're seeing an increase. Cancer risk and better nutrition. Those are our top 5. So when I, as a wellness coordinator, am working with the Wellness Council, and we're trying to strategize what are the best programs to offer for you that will help support you in making a healthy lifestyle change. These are the areas that we're targeting. And that's why you'll see various things like the fitness subsidies, like the Stairwell Challenge, like the Daily Ways program, which I'll talk about in a little bit, and the Fuel program and Peak, and all of those different efforts to try to help you. When we're looking at comparative risk data, so this is looking at, we have a group of folks that have been in the program and have had a health screening for 3 years in a row. So we're able to then see, are we making an impact with some of these folks? And the numbers are going to vary a little bit as I show you, because some people didn't participate fully in every aspect. But you can see the yellow bar is this year, where we were currently at based on our health screening. And the blue bar is where we were at 3 years ago with this comparative group. So the people that were in 2007 all the way to 2010. You can see we're getting worse for glucose, which is a screen for diabetes. We got a little bit worse with our cholesterol this year. Our high blood pressure values that were measured were a little bit better this year. No exercise program. That means we're doing worse this year, or better, sorry. I'm looking at it kind of funky. So that means that there are less people in that comparative group that are not exercising at all. So that's good. That means we're making some headway with you all in trying to start and maintain an exercise program. And then finally, tobacco use. This one is a little bit It's all self-report, so we don't know if we're having everyone's, report their data correctly on that tobacco use. And then just to kind of quick give you, I know this might be hard for you to see in the back, but just to give you an idea of how we're doing in the comparative group. This is 79 individuals who were in the program for 3 years. The men of Nebraska are the white and the black lines. So they're the two middle lines. They have stayed fairly stagnant. This is how we compare to the rest of the men in Nebraska. So the men that were in this group, you saw the blue that are overweight, they went up a little bit, they spiked up in 2008, but then in the last couple of years, they've come down a little bit in their overweight, but they're still much above Nebraska norms. And then the yellow is men that are obese. Again, we've seen a little bit of a decrease, but not, obviously, we're not at zero. Then on the female group, there were 155 women that were in both groups, or in all 3 years. And again, the black and the white are, the white line is overweight Nebraska, and the black line is Nebraska obesity. And the yellow, you can see the women spiked up in this group into a higher level for obese, but then came down in this year. So that's good. This is in the comparative group. Okay, this isn't the whole population. This is just the comparison, 155 women. And then the women that were overweight spiked up, which we're hoping that it's because they came out of the obese category into the overweight. Just real quickly, we've got some good trends going on, and that is when we look at nutrition scores comparatively, we can see if you look at the yellow kind of yellow arrow, we're seeing a decrease in the number of folks that are reporting low nutrition status. And that is when we ask you questions like, how many fruits and vegetables do you eat? Do you eat breakfast? Do you snack multiple times a day? Do you eat out? Do you eat, mostly animal foods, or do you eat vegetable proteins? Things like that that we are asked, that helps to develop this nutrition score. When we look at the 309 individuals that answered the question all 3 years, we're seeing a decrease in those that are reporting poor scores and an increase in those that are reporting excellent scores. So that's a good positive trend. If we can keep you all doing that and moving along that direction, that's a good thing. On the exercise front, we had 312 repeaters, and again, we've seen a decrease in the number of folks that have no program at all, and we've seen an increase in the number of folks that are exercising 5+ days a week. If you don't know, the goal for exercise is to get some type of a moderate intensity activity on a daily basis. So the more days a week that you can be active, the better. Finally, I just wanted to tell you about a program that we have coming up. It's called Daily Ways 2.0. And this flyer is on the website. We also have flyers outside on the table so that you can pick them up. But basically, it's a 8-week wellness challenge. It's something that you can take part on your own. You don't have to come to a group meeting. You don't have to, you don't have to talk to anybody about it if you don't want to. But it allows you to participate, and you track the habits that you take part in throughout the week. So each week you work on a different habit. One of those is moving for 30. So in week 1, you're really trying to say, I'm making a good effort to try to make sure I'm getting my physical activity. The second is eating breakfast daily. Some of you that may come very easily for, and others of you may really have to work at being consistent with that. The third being sleep. Are you getting consistently 7 to 9 hours daily? Consuming 5 fruits and veggies a day. I know from my work with the folks that are in the fuel and the various weight management programs that many of you have a hard time hitting those numbers. The more fruits and veggies you can incorporate, the better, and the program encourages you to do that. Taking 5 for health, that's talking about stress, trying to get you to incorporate coping mechanisms into your day, and water, and then eating fresh. And that means so many of us rely on eating out or foods that are prepared by other people. And so we want to encourage people to get back into cooking and preparing foods for themselves. So each week of the program, you work on one of those habits, and then by the end of the program, you're going to put it all together. And hopefully, it kind of will be a good way to kind of lead off getting you excited about getting back into better health habits for the summertime. Questions about any of the information that I shared today? The question is she's asking do we have to eat 5 fruits and 5 vegetables? That would be ideal. We would really like to see that happen, because we know with the research that if you have 5 fruits and 5 vegetables in a day, or 10 servings total, you're going to be at a lot lower risk for body weight, as well as blood pressure, cancer risk, all of those. However, the program is geared toward a minimum goal of at least 5 total. You can go higher than that, and we would like to see that, but 5 is your minimum. Other questions about the data or the program? I think what we wanted to really, our goal today was to make sure that all of you understand that when we measure, get that information in the health screening, this is how we use it. We're able to look at and be able to see, are we making an impact with the wellness programs that we have available to you? So I encourage you to get involved, jump in. Daily Ways is a free program, so don't miss out. Thank you.